Well, good afternoon, everyone, and welcome back. We are now off of recess. We are going to start the first of four public hearings. The first public hearing is agenda item number 6, and it's a public hearing on a resolution to authorize Montgomery County to procure lines of credit for the purpose of providing funds for the payment of operating expense. A Government Operations Committee work session is tentatively scheduled for Monday, July 20th. Persons wishing to submit additional material for the council's consideration should do so by the end of business today. And Ms. Kennedy, it's my understanding we do have a speaker for this public hearing.
Yes, good afternoon. We do have a speaker. She has 2 minutes to give us her testimony, and that would be Stephanie Guttormson.
Yeah. Hello. I will make this quick. It's a pretty simple proposal. I would ask that there be an amendment added to this to explicitly prevent these funds from being used for police or police services, which includes corrections and the sheriff's department. I think that it's good that you guys are procuring this line of credit, and I am for it. I just want that amendment there. That's all. Thank you. I yield my time.
Thank you very much. That is the only speaker for this public hearing.
Thank you. We will close the public hearing, and please remember that that anyone that has additional information or wants to submit additional material, please do so by the end of business today. And the tentative work session is scheduled for before the Government Operations Committee on Monday, July 20th. The next public hearing, item number 7, is a public hearing on special appropriation to the county government's FY21 operating budget for the Department of Health and Human Services in the amount of $371,761 for support payment to organizations directly serving developmentally disabled persons. Action is tentatively scheduled for Tuesday, July 21st. Persons wishing to submit additional material for the council's consideration should do so by the end of the business day today, by the end of the business day on July 15th. Ms. Kennedy, it's my understanding we do have speakers for this public hearing.
Yes, sir. We have 2 speakers, and the first is Stephanie Guttormson.
I'm here a lot today. I'm here for 3. So I apologize if you hear from me a lot. But for this one, it's actually even simpler. I think that this could be a bigger number. We could be drawing from sources, say, such as the police's budget. I would like to see some of that money used for increasing this number possibly up to an even 500,000. That's an example, but that's kind of what I would like to see here. That's my main thrust for most of these, so I appreciate your time. Thank you. I yield.
Thank you very much. Our next speaker is Melissa McKenna.
Good afternoon. My name is Melissa McKenna. I come today as a member of the ARC of Montgomery County. Many thanks to council staff for recognizing that the continuity of services budget did not account for 6 new providers. Thank you, council members, for correcting the shortfall. However, continuity of services is not enough. On July 1st, county minimum wage became $14 an hour. That same day, our governor and Board of Public Works eliminated a mandated 4% increase to DDA and BHA providers, leaving Montgomery County to fend for ourselves. Direct service providers are generous, caring, highly trained, and dedicated individuals, often more advanced in age and already scarce in supply. They have been sheroes and heroes these past months and deserve to be paid a wage commensurate with their training and experience that should absolutely exceed minimum wage. Increased funding is required, not just continuity of services, especially during this pandemic. These are essential caregivers. In working on COVID-19 recovery, I urge you to consider more than just testing for group home residents and staff, PPE, and supplies. As our county is doing all it can for small business, restaurants, and renters, this often silent portion of the community is struggling mightily and has been highly impacted by COVID-19. DHS funding must be sufficient to protect and serve these most vulnerable among us and their families by ensuring these care providers will be available to provide essential services at pandemic levels, just as many other HH services have been ramped up. During operating budget hearings, I shared the critical need for respite services. Our special education students have been home all day for months, and the need for respite care for families has never been greater. Respite requests are up, parents and children are highly stressed and isolated at home, and all routines have been disrupted. When the Provider Sustainability Recovery Planning Subgroup report comes back, hopefully soon, and a recommendation is made to the HHS committee, I implore you to support the financial stability of the ARC and all other DSPs. Remember, that lackluster business phrase is describing devoted individuals caring for our most vulnerable neighbors and their families. Thank you.
Thank you very much. That is all the speakers that we have, sir.
Thank you. We will close this public hearing. Please remember that the action is tentatively scheduled for Tuesday, July 21st. And if you have additional consideration that you want us to be considering, please do so by the end of the business day tomorrow, July 15th. Next, agenda item number 8. This is a public hearing on a special appropriation to the county government's FY21 operating budget for COVID-19 Human Services and Community Assistance, NDA, in the amount of $3 million for assistance to community clinics, medical and dental practices. A Health and Human Services Committee work session is tentatively scheduled for Thursday, July 16th. Persons wishing to submit additional material for the council's consideration should do so by the end of the business day today. Ms. Kennedy, it's my understanding we do have speakers.
Yes, sir. The first speaker is Delegate Emily Shetty.
Hi, good afternoon, County Council members. Thank you to Council President Katz and members of the County Council for your tireless efforts today and over the last few months in leading our county's response to the pandemic. These are truly unprecedented times, and while I look forward to the day we can be together again in person, I'm so grateful for all that you're doing virtually to shore up our public health infrastructure to ensure a continued strong response. I'm testifying today in strong support of the special appropriation for Montgomery County-based independent primary care practices. I'd like to extend a special thank you to Councilmember Gabe Albornoz, who has spearheaded this effort. And, excuse me, sorry, my dog just jumped on my computer. Like to, excuse me, one second, I apologize. He spearheaded this effort, and he spent countless hours ensuring our public health infrastructure remains resilient during this challenging time. I'm so grateful to have had the opportunity to work closely with him and his team on this first-in-the-nation effort. We've all seen the numerous national pieces that have shared the unique challenges that our public health infrastructure is facing during this trying time. Many practices have either already closed or are facing catastrophic financial challenges due to significant drop in patient volume since the beginning of the pandemic. A survey that was conducted in May by Montgomery County Medical Society surveyed 1,800 physicians in the county, and they found that over 80% had seen greater than 50% decline in patient volume. That has directly translated to a significant decline in cancer screenings, vaccinations, and chronic disease management. Around 80% predicted that in the next 3 to 6 months they face closure, merging with a hospital or another independent practices. And many have frozen physician pay while they continue to deliver care to patients, supplementing our county's COVID testing, and while deferring patients away from crowded emergency rooms. These independent practices in our county are small businesses. They employ county residents, and they deliver high-quality care while lowering the cost of patients to our healthcare system. We cannot let these practices fold now when we need them the most. We are headed into an anticipated surge of cases in the fall, and this is an all-hands-on-deck moment. Hospital-owned private.
Time is up, Ms. Shetty. Your time is up.
I'm sorry. I just had one last sentence. I'm sorry. Hospital-owned and private equity-owned practices, they're not facing the same financial hurdles that the smaller practices are facing. I just want to thank the county for its recognition of the unique nature of these practices, and thank you for supporting them now via this special appropriation. Thank you.
Thank you very much. Our next speaker is Uma Jayaraman.
Dear Council members, thank you all for your continued efforts to help the citizens of Montgomery County during this pandemic. Also, thank you to Councilmember Albornoz for his organization on this special appropriation. I'm a family physician testifying in support of this bill on behalf of Potomac Physician Associates, PPA, a community-based physician-owned practice with 3 locations in Montgomery County, Germantown, Chevy Chase, and Bethesda. PPA provides primary care for over 40,000 patients. Approximately 12,000, roughly 30% of our patients, reside in COVID hotspot areas. We take great pride in caring for the community. We started testing for COVID on March 10th before most facilities were on board with testing processes. We have tested over 1,000 people for COVID since that time. We believe that we have been able to slow the spread of COVID by supplementing the county's testing efforts. In addition, we continue to provide essential round-the-clock comprehensive care such as virtual visits, in-person office visits, vaccinations, lab draws, telephone, and portal communications. Since the start of the pandemic, we have done over 17,000 virtual visits. Our practice is solely physician-owned and independent. We are not part of a larger conglomerate. The owners of the practice froze our own wages to ensure that our staff was paid and that we could continue to deliver the care our community needs. In addition, we have been providing COVID-19 testing to our patients at a financial loss. Primary care practices need a separate and dedicated lifeline during these extraordinary times to ensure that we can keep our doors open and continue to provide care. It is for this reason that we support this appropriation and thank the Council for its work. TPA sincerely appreciates your advocacy and humbly requests your support of this special appropriation. Thank you very much.
Thank you very much. That concludes our speakers for this public hearing.
Thank you. Councilmember Albornoz.
Thank you, Mr. President. I want to thank all my colleagues for their support of this. And Delegate Shetty, I especially want to once again highlight your efforts. You have done incredible work in coordination with many of these medical practices, and I wanted to express publicly my appreciation. Your family has uniquely contributed a lot in response to COVID here in Montgomery County, and I very much appreciate you, Delegate Shetty, and your leadership as well.
Thank you, and we all agree with that. We're going to close this public hearing. Please remember that you have until tomorrow, or until Thursday, July 16th. You have until the close of business today to submit additional testimony, and the HHS committee will be on Thursday, July 16th. The next item is item number 9. This is a public hearing on a special appropriation to the county government's FY21 operating budget for the Department of Housing and Community Affairs, also known as DHCA, in the amount of $4,847,976 for Emergency Solutions Grant COVID-19 ESG-CV. Action is scheduled immediately following this hearing. Ms. Kennedy, I understand we do have a speaker.
Yes, sir. That would be Stephanie Guttormson. Ms. Guttormson, are you there?
I sure am.
You may begin.
Getting me this. Sure. For this particular bill, I would like to see this money be used in buying up property that's currently empty and providing that housing for those without homes for free. Unhoused persons are extremely vulnerable, especially during this time of COVID, and it would be nice if this money was used in a way that actually provides what these people lack, which is a home, an actual shelter to live in. It's not enough to fund shelters. We actually have to get these people in their own shelters. It would be nice if that happens. And again, I would like an amendment to explicitly exclude any police services from receiving these funds. And I yield my time. Thank you.
Thank you very much. That is all we have for this public hearing.
Thank you. We will close the public hearing. Would someone like to make a motion and a second, please?
So moved.
Who was the so moved? Councilmember Rice made the motion. Councilmember Reamer was the second. All those in favor, please raise your hand. And that carries unanimously. Thank you very much. Next, it's my understanding, and I'm double checking this, but it is my understanding we were going to have an interview for a planning board a person who had applied for the planning board who could not make it the last time we had the interviews. And it's my understanding that they've not been able to contact the gentleman. Is that still correct, Ms. Michelson or Madam Clerk or someone? Is that still correct?
Yes, that's correct.
So we will not have the interview with that person. We now can go to a proposed closed session. Let me get my notes here. Proposed closed session to discuss before a contract is awarded or bids are opened, a matter directly related to a negotiating strategy or the contents of a bid or proposal, if public discussion or disclosure would adversely impact the ability of the public body to participate in the competitive bidding or proposed process pursuant to Maryland Code General Provisions, Article 3-305, subsection B 14. Topic is contract negotiations with banks for line of credit. Is there a motion?
So moved. Can we do it now, or do we have to wait until 2:30 for that?
Now, it's my understanding we can do it now, but we're going to double check that. And it was seconded by Councilmember Friedson. Ms. Michelson or someone, is it, can we go now directly to that now?
Yes, we're prepared to start.
Okay. So it has been moved by Councilmember Reamer, seconded by Councilmember Friedson to go to closed session. All those in favor, please raise your hand. And I say unanimous. It is a 9-0. Thank you very much. We are going to be adjourned this meeting.